So we're going to do another cranial demonstration. So again, we have to calibrate. Show me yes, show me no. Good. Permission to work with the cranium. Yes, permission to work with realignment and a recoil. Good, so we have that. So this might not necessarily be her priority, but we have permission to work with it as part of the workshop. So again, I'm going to ask, is the base the priority? No. Is the vault the priority? No. Is it the face? Yes. Okay, so it's the face. So now with the face, you could do something very quickly. You could say, is it something in the central aspect? No. Is it something on her left side? No. Right side? Yes. So it's something here on this right side. So then in the face here, the right side I could say, is it the nasal bone? No. Is it the maxilla? No. Is it her zygoma? Yes. So it's a zygoma. Okay? So if you come in close, you can see here, if I put my fingers underneath her zygoma, you can see there's a significant asymmetry. Yes. And you can see that.
And
you feel that?
This.
Yeah.
So
you feel
depressed.
both ways. Yeah.
Yes. And you see the
Yeah.
logo?
So I see that as well, what he said? Yes. So it's like this and like this.
Yeah.
So there's an asymmetry in the zygoma. I'm also going to come in here and I'm going to try to, not much here, not much here. There's very stuck there.
Are you pressing,
Just lifting it
lifting it
upwards.
upward? Okay.
Yeah, just lifting upwards. And all these tests are all in the teal book. Okay. All right. I might just evaluate. Can you come to the edge of the table for me? Because I'm going to do a little extension as well. Keep coming. There we go. Good. So I just want to feel. Yeah, right away I feel tension there. She moves easier this way. And right there, there's a little bit of a, you can feel that, a little bit of a tension there. Maybe come a little bit more into the edge, just a touch, about an inch. There you go. So it's extension all the way down. She seems to go better to the right, but to the left, there's just a little bit of a pull in there. Okay. I'm gonna check her inflection, which is here. That moves quite well. Okay, a little bit of a sticking point there. And let's see the side bending. The reason why I check these is not too much significant there, but there's a little bit of a difference here. And this may or may not be from that, but there's a little bit of inflection.
Thank you.
What happened?
There we go. All right, so you can slide up on the table a little bit. Now, what her body's telling me is that she's got something going on at T4. So just roll on your stomach for a second. So arms by your side. So if I go to her inferior scapula here, this is T7. 6, 5, 4, and you can see quite a bit. You can see there's an asymmetry there at T4. So you can see that. And she's level there, but right at T4, so you have a feel. So there's some, and T4, and remember in total body balancing is an area of connection, right, from the upper and lower body. But she's, and if I go in there and try to do a spring test there, very rigid there.
Feels guarded.
Yeah, roll on your back. Okay. So here, so this is the zygoma that we're working with. And I'll get you to palpate there if you like. And I'm just going to pull that out. So I'm going to pull it here. And it actually wants to go in and down. Right there. Breathe in and out, tap over your heart. Good. All right. And breathe in. And down. Breathe in. And down. So if I feel the shift, I don't need to do 2 breaths. I just, if I feel it, a lot of times it's in 1 breath. I tell you 2 breaths, just in case you don't feel the shift. Good. All right. So now I come here, look at this, zygomas are level,
Yes.
and they're level here as well.
Less tenderness to the touch there too.
You were tender there before?
When you touched it, I was.
Okay.
At first.
The first.
Yeah, not now. It improved.
Oh, I can move this zygoma now on this side.
Substantial more movement.
Yeah. Yeah, much better movement now. So there's a better glide, osteoarticular glide.
Yeah. You will smile better.
Come towards me so your shoulders are all the way at the edge. Keep coming.
More?
Yep, that's good. I just want to just feel here. Oh, this is so much better. Look at this. So that feels easier.
Well, because of the,
And I feel less strain pulling through the shoulder,
Shoulder?
when I turn my head, yeah.
Let's see what you're like in flexion. Oh, this is easier to come up. Oh, much easier. She had the problem to the right. Feels lighter in her head. That can move easier. The end feel is better. Okay. Can you roll on your tummy? Arms on your side. Okay, perfect. So there's.
Oh, it's
7,
already
6.
softer. I can
Yeah,
feel
right
it.
there. You can see that's more level. And I'm gonna come in here and just do a spring. Look at this.
Oh, I'm spinning.
That's springing now. You feel? And then the more you do this, what happens is that if you forgot something, like I
Thank
work
you,
on it,
Herbert.
the body will tell you, oh, T4 is part of this. The body will let you know what's part of it. Okay, thank you.